You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hi, everyone. Back at Stellar Success Podcast. Shellie Shouse from Kentucky. How are you?
I'm great. Great. I'm happy to be here. I've listened to your podcast and it's been very interesting.
Yes, thank you very much. Thanks for being here. Shellie, you are not a doctor. You are someone who works in healthcare, but has a completely different credentials. Can you walk us through your journey, a little bit of a story for yourself?
Sure. I wish I was a doctor because I have so much respect for them, for the investment and the risk they take to do what they do and the time they put into it. Just utmost respect for them. But I do enjoy working with doctors. And I will say that I started out in accounting because ever since I was a little girl, I was always thinking about business things and I was starting my own businesses. And then my sister had told me 5 quarters equaled a dollar bill. So one day I found out a math test that I tricked and I thought, okay, nobody's going to take advantage of me anymore when it comes to money. I'm going to learn all about money.
That's funny.
I had my heart set from an early age to become a certified public accountant. And at that time, honestly, healthcare never came across my mind. I just thought I'd be a businesswoman and maybe travel the world. And so I did that, got several degrees, got my master's in business, and I did have an interest in healthcare. So how it started was when I interviewed with different CPA firms, the ones that had a healthcare background interested me the most. And so when I had different offers on the table, I decided to go in healthcare, and I'm glad I did. It was just fascinating to me. And as you know, healthcare is ever changing. I mean, there's never a boring moment in healthcare. So I started off learning how to do Medicare cost reports. So, and then it did have a background of accounting in it, but it was a totally different animal. So it's like a very complicated, big tax return, but it includes cost accounting in it. And that's what you use for your Medicare rates. And then Medicaid may follow depending on the state and how that works. So anyway, when I worked in public accounting, I was able to travel to different hospitals and I did financial statement audits or I did consulting work. And then I thought, I would love to be a chief financial officer. It just seems like it'd be fun to do that type of work at a hospital. So I did end up in that route, but not right away. I've worked in large hospitals. I've worked in small hospitals. And in the smaller hospitals is where I really was able to wrap my arms around how everything works together. In the larger hospitals, I learned a lot too, but I had to be more focused on a specialty. For example, when at one point I was executive director of a revenue cycle for a large healthcare system. Earlier on in my career, I was a reimbursement manager, focusing on making sure we were getting reimbursed appropriately from the payers. And then, I was on my 3rd critical access hospital as a chief financial officer. And I was like, okay, I can do this stuff in my sleep. I'm getting kind of tired. I want to do something new. I want a new set of challenges. And boy, did I get it. But I'm loving it. It's never boring. And I've been very fortunate to be a part of a smaller healthcare system that is more complex than your typical like critical access hospital. So I am in small town USA. And but I will say that I'm pretty sure we're the only smaller hospital that does robotic surgeries. That we use the Da Vinci Xi, we do the Mako. We have outstanding surgeons that have joined our team, and we've done some amazing things that most organizations don't get to do. And I will say, the last time we were strategic planning, we found that we had more outpatient revenue than any other critical access hospital in the state of Kentucky. One thing that we were doing, which was amazing, was we were helping postpartum patients from all over the states. We even had some come from Alaska to Kentucky, rural town in Kentucky, for these 60-hour infusion of Xarelto. And these postpartum patients would come here they might be suicidal, not wanting to hold their baby, and then they would leave here happy, holding their baby, loving on their baby, and it was just amazing. And I will say we did that for a while, and it was changing lives. And we do things like that are out of the norm here. But we did have to disband it because they started making the drug in pill form and capsule form. And although that's not nearly as effective as the infusion was, because there's a diet that comes along with it that you have to follow, which, that's very difficult in America with our standard American diet to follow special diet. So they don't have near that as good of outcomes. But, as you know, insurance drives a lot. And that was a very expensive thing. So patients couldn't pay for it out of pocket. So we don't do that anymore. But we're always doing something new, trying to help our hospital system be able to stay relevant and help our community, because it's tough for a small independent healthcare system like us to keep our doors open. And so we've been very fortunate.
Well, yeah, so that's what I want to kind of get into a little bit more and deep with you, because these are the back doors of healthcare. As doctors and medical professionals, we're used to go to work, see patients, practice medicine, and we don't really care about finances in terms of like the whole supporting structure, either is in a hospital or a clinic or office or whatever. But this is what drives healthcare, finally. So from your point of view as a CPA and a finance person, what do you think is the most important thing for a hospital to survive? Not to thrive, to survive.
To survive. Well, I would say if you don't take care of the patient, then they're not going to come and you're not going to be there anymore. So ultimately, the money follows the quality of care you provide. But the revenue cycle plays a big role in it, making sure you can get paid, and staying on top of the politics and how you're being affected. For example, 340B is so important to smaller hospitals, or any hospital really. Can
you give us a little bit more background on this for people that don't know?
So that is 340B is a program where the pharmaceutical companies had this agreement with the government, and they would give us better pricing on their drugs and make them more affordable. And so there were some concessions there. Well, it allowed us to contract with local pharmacies so that if our employed physician, gave a prescription at that local pharmacy, that pharmacy could better afford to give that to the patient. But because we have this contractual agreement with that local pharmacy, we're able to sell it to them and make a little bit of profit for our risk in that, because we're the ones employing these physicians and taking all the risk with that. But also, it also helps hospitals keep their doors open like us, because there's a lot of programs that don't pay enough. Like, we don't make full cost on Medicare and Medicaid patients, and definitely not on self-pay patients, because typically they can't pay their bills. So you got to make your money somewhere. And so allowing us to make some profit on that, what allows us to be able to offer services that are not money makers, like behavioral health services, which we do a pretty good job of offering our community. And it was needed according to our community health needs assessment. But we couldn't be able to do that type of thing without 340B savings that we are able to.
So from that point of view, in a life of a hospital, give us some examples of like the most profitable services you guys have, like for your specific hospital, but in general for hospitals, like the most profitable ones.
For us, I would say our surgeries, such as the orthopedic surgeries and ENT surgeries or GI or what have you. That's probably the most profitable, because that's making a big difference, and insurance realizes that and they're willing to cover that. I mean, I'm sure there are things that do pay a big difference, like the Xarelto program, they're not going to pay for anymore. But I'd say that. So
it's interesting, because I want to get a little more deeper into this thing. The wave of outpatient surgery centers. It was a tsunami a few years ago started, and I think we're still in it right now. This is one of the biggest threats, I would say, for a hospital, and a small community hospital, to be able to retain their surgical team into the hospital instead of like outsourcing to an outpatient center and not have control of money that comes in. So how do you deal with this? It's a very difficult task to handle.
It
Like, do you,
really is. Yeah,
yeah,
especially depending on what state you're in. So in Kentucky, there's a certificate of need that you have to obtain in order to build one of those. And as you know, if it's a separate building from the hospital, it may cost less for that insurance company sending that patient there. But because it's not connected to the hospital, if something goes wrong, you don't have that emergency care right there. So me personally, I would want to have my surgery at a hospital, not at a standalone. Unless it was something minor. But so through Kentucky's certificate of need, I think that helps. And I would say that, being a businesswoman, I understand in typical retail, you want more competition that helps drive down price, but it's very different in healthcare because we don't get reimbursed the same way that retail might. Retail's typically pretty simple. I'm going to give you cash for this bracelet and I get this bracelet in return, where we have to fight tooth and nail, get reimbursed for what we do. But also, as you know, in the healthcare industry, we really struggle with staffing. I know, a lot of industries are, but especially after the pandemic, a lot of people retired early and a lot of people decided to exit healthcare. So there's not enough healthcare workers to go around. So staffing is a real problem. Then that affects patient care for both. If you have an ambulatory surgery center in one area plus the hospital and you're trying to staff both and you end up being spread thin at both, the patient suffers. And that drives up costs in both areas.
yeah, it's an interesting dynamic here because the pool of staff, it's more or less the same, right? Especially in a small community. You deal with the same nurses, you deal with the same doctors going to the hospital or to the outpatient center. And obviously the financial incentive is there for them to have their own place. I'm talking about the doctors and surgeons, but in the same time, isn't it an opportunity for you as a hospital to maybe partner with those groups and benefit from their own enterprise? Is that something
Yes, if
that
there's enough volume.
Yeah,
If there's enough volume and we can create the staff to do it. Typically in a smaller town, there might not be enough volume
yeah,
for both to be profitable. But yes, and we're always open to looking into those opportunities.
yeah.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
Interesting. What do you think is the trend for 2025 in terms of how you deal with reimbursements? Because this is not going to get better
You're right. That's
anytime soon.
Right.
And you need the imagination, you need a plan, you need a strategy to get more money in for the same amount of services with less staff. So what is the solution here?
Creativity. And that's what our team has been so good at. I've been blessed to be surrounded by outstanding people who think creatively. And right now we're working on some things we can't share with the public, but we're creatively thinking about solutions to replace revenue streams that we're losing. Like we are losing some of our 340B because it's been under attack. And I know that some larger systems may have taken advantage of it, but it's a lifeline for many other hospitals. And as that goes away, you'll see more hospitals closing. We're unique in our situation, being local and independent. But we've been fortunate where we have been able to gain consumer confidence in our area. And we have patients coming from different areas to our system because we believe in excellence and outstanding care. And we have an excellent surgery wing that where we moved our old OR rooms to a new rebuilt one, and then we're renovating. And so we have state-of-the-art equipment and stuff like that. And that's not typical for a small rural hospital. So, that's one of the reasons we've been able to stay alive and thrive. But not all are able to do that.
Yeah, no, definitely not. And I've heard some horror stories, with small rural community hospitals in general. But where do you get the money from to be able to invest in new buildings or renovations? And how do you manage this financially?
Well, we have some great relationships with our local banks. And one in particular likes to help us a lot. And we partnered with the USDA to help us build our surgery wing. And so, but we also had to prove to them, okay, we know we have to pay for this. And we believe that because we have certain physicians and what they can do and what new types of surgeries we'll be able to do because our surgery rooms are bigger and we can do the robotic surgeries. We did all these calculations and said, we believe our surgeries will increase by this much. And they've increased by even more than what we predicted. And so that's helping us pay those bills.
Yeah. Obviously, patient satisfaction and patient retention is probably the main drive here because, instead of going to bigger centers and more popular centers, they have to choose to come to your community hospital. It's a job that most people don't see, but your job, I think, it's a financial practice, I would say, that help the doctors and the healthcare workers practice medicine correctly and with no fear something's going to happen, right? Because they need to have this like financial structure in place to know that the hospital doesn't go bankrupt. You guys don't go anywhere. Don't close the gates next week. But what does it take from your point of view to be successful in this? Because, it's one thing that you keep the doors open and another thing to be successful in this enterprise.
Well, I say looking at process to make sure we're efficient. And to me, it's very important to me that our physicians are happy, that we're making their jobs as easy as possible to see the patients and take care of the patient. Whatever we can take off their plate legally to help them focus on the patient, we can do, because they're paid bigger bucks and they should be, but we utilize other staff to help support them so that they can see more patients. And one of the things that we're going through now is we converted to a new electronic medical record system because we had purchased so many practices and we're running way too many different ones. And that's going to help us. Right now it's a little rocky because we're getting through the aftermath of a go live, and but we can already see the light in the tunnel that once we work out all the kinks, it should make processes better for our physicians. And we're starting to use some AI and some tools to help them.
I think the AI is going to save the electronic medical record systems. I haven't had anybody telling me that's so happy to have the electronic medical record system in place so far. It's always, something goes wrong with it, or, the people are not happy with it, whatever. But I think AI is going to come in there and probably fix the little kinks. What's new for 2025 for you? What are you planning? What's your strategy? What are you looking forward to?
Well, I will say we're starting our strategic planning session again. We start with our community health needs assessment and we take a poll of what's needed because we are a nonprofit. So of course you got to make some kind of profit to keep doors open, right? But so as we take that assessment in, we'll look at that and see, okay, what financially can we do to help what the community needs while still keeping our doors open? And so, one of the things we do in our strategic planning is we look at all the data and we say, okay, what kind of patient care are we not offering that's needed? What are people leaving our community for? And so each year we end up coming with a plan of what type of physician or specialty we want to bring in and recruit. So, and we make sure that it's going to pay for itself too. We can't just bring in all these lost leaders. So that's a big piece of it. But we also evaluate what's making money and what's not. What we might have to cut something out. Earlier on when I was a CFO here, I had to evaluate our chemotherapy program, and the payer mix was just terrible. We we were losing a lot of money on it. And but if you got one self-pay patient, it just could, really cause a catastrophe. And then we had to put, because, governmental regulations are so expensive. And so there was this pharmacy hood regulation that we had to follow, and it's going to cost us a ton of money. And we're like, we're going to stop losing money on this. We're going to cut this off and invest our money in other areas that patients need that we can afford to provide that care in.
Yeah.
And there's other things that we've evaluated, and we said, maybe later, not now, just trying to, because, especially in a smaller healthcare system, we're all wearing more hats. And so we've got to figure out what's the best use of our time. We don't want to keep focusing on all the smaller projects. We're going to focus on the projects first that matter most.
Yeah, obviously. If you would go back when you started this job and career, what would you tell yourself? What would you change? What would you do better?
That's a good question. Because I think I would have done a lot of things the same way just because I had the same information then. But if I had different information, I might have to circle back on that one.
Yes, it's not an easy answer, and I'm sure people struggle with this idea, and most of the time it's hard to put yourself in a frame of mind that you were whatever 15, 20 years ago, with technology basically ramping up so fast and things changing so fast. And
well, when you talk about fast, so we had some opportunities come to us we weren't looking for. Some surgeons that came to us and said, we want to work with you. And, that wasn't part of our plan, but it was definitely something our community needed. And so we jumped on those opportunities. But I will say we didn't have the infrastructure to take on. So we had tremendous growth in just the few first years of me being the CEO. And so I would say if we could have prepared ourselves better so that we could take on all the new professional billing that we were taking on. And because we changed a lot of things too, with like anesthesia, and we brought ER in-house instead of contracting that out. We did a lot of changes, and we would have had a better support system in place because,
those services are always a tough thing to tackle, ER, anesthesia. What was the solution basically? Because I know the employee model works, very well for some hospitals, small hospitals. Mm-hmm. What did you guys do?
Well, for ER, the very first day I was officially CEO, that was our first day of actually bringing it in-house because it just wasn't working out with our contracted company. And it was a struggle. I was calling physicians personally, asking, can you come in, please? But now we don't have that problem. We have plenty of physicians that want to work here, and we, have a good schedule going. Now, prior to me becoming CEO, the last CEO, he did a fantastic job getting some outstanding anesthesiologists here. He contracted with a really great group of them. And so we're pretty steady there. And I think that's helped our surgery team even more. We have some great staff, just excellent reputation. And so that's helped attract the right people here.
Yeah. Good people bring good people.
That's right. Yeah.
Yes.
I'm very blessed with that for sure.
Yeah.
All those pieces together and trying to instill a great culture, I think, helps. Because like what we believe in outstanding care here. It's a play on our Ohio County healthcare, OCH. And when we say OCH, we're saying that's outstanding. We're here to be giving the best outstanding care we can to everyone we can come in contact with. We even have a bachelor's program for our employees that they're incentivized to educate themselves on what we believe about customer care and taking care of everybody. And that has helped us transform our culture to one where a lot of employees seek us out. And so, yes, we still struggle to fill all the roles because there's just not enough people who have those certifications out there or what have you. But we've been fortunate to build that reputation where people want to come and work here.
Mm-hmm, mm-hmm. Yeah, it's very important to build this kind of community spirit in a small hospital. And most people don't realize that a lot of America's people and patients are in this situation. They live in, in counties that they don't have necessarily, a good healthcare system or a good hospital, or offices or clinics, and it's their only lifeline, especially in the emergency room. And I always wonder if, like you said, people like you can be multiplied in some way, like your experience and your wisdom can be shared in a way that more people would do this in their own communities. It's funny because I started my career in the same setting like you are. It's a small community hospital that was serving somewhere an isolated county, and I've seen firsthand for a couple of years how important is to connect with patients there. It's a very different perspective than a big hospital or a big city.
Taking care of our own here.
Yes, yeah, and that's where it starts. And I'm trying to bring. I brought that with me in a different setting when I moved, but I can certainly I would say advise everyone that has some kind of curiosity of how a small hospital is run to reach out to you and get some of your experience. How can somebody get in touch with you and learn more about what you're doing, how you do it?
Sure. Well, my email address is ceo@ochcares.com. But I'm also on LinkedIn. Spell my name Shellie and then Shouse. I don't think there's any other one out there with that tongue twister of a name or red hair. So I think I'm pretty easy to find on LinkedIn. Yeah.
That's great. Thank you, Shellie. I appreciate your time, and hopefully, you guys gonna continue to thrive there in the community and give an example to everybody else.
Thank you. It's been great talking to you. I appreciate the invite, and I'm really enjoying listening to your podcast. You have some interesting speakers.
Thank you. I appreciate it too. Thank you.
Take care.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.